All right, so I'm here waiting to be tortured by Shar, and we are, how far am I out? It was on the 11th, it's the 27th, so almost 2.5 weeks-ish, and I found some cool shoes that I can wear with roominess, so I can keep my feet in them. Let's get to work on Shar torturing me. She's really excited about that today. So, we're gonna work on range of motion and I am 2 weeks after bilateral cheilectomy surgery, where I had surgery to correct Hallux Rigidus that I have had for about 7 years on both feet. And I've found 3 important things that have helped me to recover faster and get back to activity faster. So I'm 2 weeks out, so I'm not running marathons or 5Ks or anything like that at this point, but there are some specific things that have really helped me. I'm going to go in order of importance, in reverse order of importance. I'm going to save the best for last. The third thing is something that's really helped me to get back to activity and feel like I'm not just down and atrophying. So number 1 is making sure you're controlling swelling. So through the course of the last 2 weeks, I've been elevating my feet. I've been trying to control swelling with not being too active on my feet and things like that. If you control swelling, then the incision doesn't get stressed and you don't pop stitches. So that's important to keep your healing process going and making sure that you're not overdoing it so that you have a lot of swelling. So keeping your feet elevated, trying to stay on top of the pain, things like that. I didn't take a whole lot of ibuprofen, but I took some, and that can really help so it's not as swollen. I did go for, about a week ago, I went for my 1 week post-op checkup, and they took the bandages off, so I saw the stitches kind of for the first time. So this is what it looked like.
Oh, that looks good. Okay, I'm just gonna pull this off your toe. Does it hurt? Oh no, there we go. No. Look at those beautiful colors.
I was noticing those creeping out in my toe.
Yeah.
That was nice.
Very minimal drainage. It looks really good.
Well, I've been a perfect patient.
Have you? That's saying something, especially with your profession. Well, that's gonna just slip right off.
Nice on napping, so you did okay.
Okay,
You did that one.
same. Does look a little bit more
colorful.
fluffy. It actually looks really good, though. It really does.
So after having my stitches revealed, I didn't have a lot of swelling, but I did have some that was kind of pooling around my toes because I'd gone back to work that week. So that's what it looked like a week ago. So over the last week, I had the stitches in. I was kind of disappointed that I wasn't able to get stitches out at that point, but a little more healing is probably for the best. So over the last week, I've been more active. I did a full week of work, and so that brings me to number 2. The number 2 important thing is starting with a physical therapist, ideally, or someone who knows what they're doing with getting your range of motion back. I was working on range of motion myself and trying to get that extension range of motion, trying to get mobility. That also helps with swelling as long as you don't push it too hard. But you have to make sure you're not stressing the incision. If you're stressing the incision and that incision pops open, then we just kind of start back, well, not start back at 0, but we have healing that has to take place and infection risk that takes place. So I used one of my therapists at the clinic, Shar, and Shar helped and currently is helping me get my range of motion back. It's not the most pleasant, but it does really help to get mobility, because that's why I did the surgery in the first place. Pain was one thing, but my mobility was really limited. So we're starting to get that mobility back. So the most important thing that I've learned in the last 2 weeks, and the tip that I wanted to share the most, is how to be more active even while we're protecting this. So a week ago when I did my first post-op appointment, he wanted me to stay in the post-op shoe. And the post-op shoe is very fashionable and very uncomfortable. And I was finding that I was having more pain being in this shoe. He wanted me to stay in the post-op shoe because it limits the motion at the big toe. And the sole is really stiff and rigid, and it's really the one-size-fits-all solution to that. But I found a better solution for myself. This may not work for you. But, so if you look at my feet, I found that, so these North Face slippers, they're called the Thermoball slippers. They have worked fantastic to get back to footwear. They have a great tread on the bottom that, I mean, it's starting to be winter here in Utah, so it's getting a little slicker. And they come in crazy cool colors. And they're easy to get my foot in. And that's the biggest thing, is the back goes down, so I can put my foot in here and I can just slip it on, and then I can pull the back part up and over it. I don't have to go into a shoe how you'd normally go into a shoe. So that has been a game changer for me, getting into shoes that I can wear to work and outside and that are comfortable. Because really, the post-op shoes, these shoes, were actually hurting me, I think, a bit more. The key with this, though, is what I put inside of it. So I have a carbon fiber insole that is really thin, but it doesn't allow for much bending. I mean, it's carbon fiber, it's really light, and if I put that in this shoe, then what happens is we get a comfortable shoe. It has nice fuzzies on the inside and stuff like that. And I have to be careful because my kids are probably going to start stealing these because they're the same size of foot as I am. But we're recreating that stiffness of the sole with that carbon fiber insole. You can get those on Amazon. I'll put a link to that in the description. And I'll put a link to these slippers. I mean, I'll call them shoes. They're not really slippers because I wear them outside doing everything. But they are so comfortable. So the combination of the carbon fiber insole with the North Face Thermoball shoes has been really helpful for me to get back to activity and walk. I can walk pretty normal with this, but I'm still protecting that incision. I got the stitches out, but we still need to protect it. It's still weak. This week is when we really want to protect it until it solidifies and tightens up. And so this allows me to get back to activity. It allows me to do things at work and not look like I just had surgery either. So you can get a color that's less flashy than this if you want, but I think this is a great combination to get back to activity. It is a little slick on that carbon fiber, but if you wear a sock, it's totally fine. So those are the three tips. Number one, control your swelling and control your activity. Number two, what was number? Oh, range of motion. Starting your range of motion, working ideally with a physical therapist who's done this before, that they can get some range of motion at your big toe and get that joint moving, because that's what we really want, so it doesn't scar down and tighten up to get the mobility. And number three, some footwear that protects the incision while it allows you to be more mobile and active. It was driving me crazy not being as active. So hopefully that was helpful, and hopefully you got something out of that. Don't forget to subscribe to the channel, because I'm going to be doing more as I continue to recover from cheilectomy surgery. Next week I'm going to get back into biking on a Peloton and things like that, and I'll detail the whole journey. So hopefully, if you're having the same issue, if it's on both sides, you're kind of like me. If it's just on one side, you can still use these ideas. So thanks for watching, and we'll see you next time.